Investigations of iron deficiency. Confirmation of iron deficiency. Serum ferritin is a measure of iron stores in tissues and is the best single test to confirm iron deficiency. A subnormal level is most often due to iron deficiency or very rarely hypothyroidism or vitamin C deficiency. Ferritin levels can be raised in liver disease and in the acute phase response. In these conditions, a ferritin level of up to 100 microgram per liter may still be compatible with low bone marrow iron stores. Plasma iron and total iron binding capacity TIBC are measures of iron availability. Hence, they are affected by many factors besides iron stores. Plasma iron has a marked diurnal and day-to-day variation and becomes very low during an acute phase response, but is raised in liver disease and hemolysis. Levels of transferrin, the binding protein for iron, are lowered by malnutrition, liver disease, acute phase response, and nephrotic syndrome, but raised by pregnancy and the oral contraceptive pill. A transferrin saturation iron divided by TIBC into 100 of less than 16% is consistent with iron deficiency but is less specific than a low ferritin measurement. All proliferating cells express membrane transferrin receptors to acquire iron. A small amount of this receptor is shed into blood, where it can be detected in a free soluble form. When iron stores are low, cells upregulate transferrin receptor expression, and the levels of soluble plasma transferrin receptor increase. This can be measured by immunoassay and used to distinguish storage iron depletion in the presence of an acute phase response or liver disease, when a raised level indicates iron deficiency. In difficult cases, it may still be necessary to examine a bone marrow aspirate for iron stores. Investigation of the cause. This will depend on the age and sex of the patient as well as the history and clinical findings. In men and postmenopausal women with a normal diet, the upper and lower GI tract should be investigated by endoscopy or radiological studies. Current guidelines suggest exclusion of celiac disease by antibody testing at an early stage of investigation of iron deficiency. In the tropics, stool and urine should be examined for parasites.